Good morning, everyone. Thank you for coming. I think it's very important to me, and it's very important to DEA, that the story of fentanyl should not be told solely from the law enforcement perspective. So to that end, I am going to identify some of the people in our coalition and some of the families that are here today. So please permit me a moment to do that. Senator Melissa Mendes, 28th State Senate District, State of California. Acting United States Attorney Tracy Wilkerson, Central District of California. Dr. Jonathan Lucas, LA County Coroner, Chief Medical Examiner. So-Kum Fu, Los Angeles County Office of Education. Major Matthew Haygood and Corporal Marisol Toro from the California National Guard. Douglas Barrios, Natalie White, and Amelia Lopez from the LA Sparks. Fred Thomas from the DEA Citizens Academy. Doug Rice from the Community Anti-Drug Coalitions of America. Edgar Sebastian from the Helpline Youth Counseling Organization. Martha Dorantes, Alcohol and Drug Prevention Manager. Tanisha Taylor, Watts Healthcare Corporation, Youth Education and Prevention Manager. Gudrun Giddings, Chairman of the Board for the Mentor Foundation. Jean Shimatsu, Asian American Drug Abuse Program. Jennifer Harris, South Bay Communities Creating Change and Prevention. Janice Gardner, Office of Ventura Behavioral Health. Nicole Sun, Cambodian Association of America. Tiffany Tan, Asian American Drug Abuse Program Incorporated. Erica Winston, Behavioral Health Services Incorporated. Claudia Hathcock and Alfredo Camacho from Day One. We also have with us today families who have experienced the tragedy of overdose firsthand. We have Matt Capilouto here with his wife and 3 daughters. We have Amy Neville, mother and founder of the Alexander Neville Foundation. We have Jaime Puerta, father and founding member of the Fentanyl Awareness Coalition. Steve Filson, father and member of druginducedhomicide.org. And finally, Ed and Mary Turnan, parents and founders of the Song for Charlie nonprofit. I encourage the members of the media to speak to these treatment, prevention, and community health professionals, as well as the business leaders and families who are present, to get their perspective. In reality, they are the ones on the front line who have experienced firsthand the harm caused by illicit drugs in our community. The Centers for Disease Control will soon be releasing the overdose death statistics for 2020. Tragically, these numbers will show 2020 was the deadliest year on record. Especially troubling is the impact the increase in drug overdose deaths is having on us here locally in the greater Los Angeles area. The synthetic opioid fentanyl is playing a major role in this. As a community, we should not continue to tolerate rising drug-caused death rates, and we certainly cannot allow it to become something that is accepted and normal. Operation Engage is an effort by DEA and our partners to present a more comprehensive drug harm reduction strategy. Our focus for this operation is fentanyl, as well as other opiate drugs. Fentanyl is now involved in approximately 49% of the drug-caused deaths in Los Angeles County and approximately 42% of the drug-caused deaths in Riverside County. How did we get here? At the height of the prescription opioid crisis in 2012, over 250 million opiate prescriptions were written in the United States. The number of prescriptions written has been steadily declining since and is now at around 150 million per year. Unfortunately, as the number of prescriptions has been moving down, the Mexican drug trafficking organizations have moved in to fill the void with counterfeit prescription drugs. Manufactured in Mexico, containing fentanyl, they appear to be pharmaceutical drugs like Xanax, oxycodone, and Percocet, but they are not. They don't contain any of the pharmaceutical ingredients and instead contain clandestinely manufactured fentanyl. The counterfeit nature of these pills is a major contributing factor to the deaths of young people in our community. They think the pill is a legitimate prescription drug, and they are completely unaware it contains fentanyl. LA is a major transshipment center for these pills after they are imported from Mexico. Some of the pills are transported out of state, and some are sold locally by traditional methods on our street corners. More and more often, however, we are seeing these drugs sold via online marketplace, social media platforms, and smartphone interaction. Last year, we seized 1.2 million counterfeit pills containing fentanyl here in Los Angeles. And there are more than 10 times as many of these pills on the street today than there were just 3 or 4 years ago. During Operation Engage, DEA will prioritize investigations targeting fentanyl. We will continue to view distribution of drugs resulting in overdose deaths as a crime of violence. The reality is, however, that law enforcement alone will not be able to reduce drug harm sufficiently to protect our families. We need the help of the community to increase awareness about the effects and dangers of fentanyl and other opioids, and we need to educate and empower our young people so they can make intelligent and informed decisions about drug use. Our goal is to empower communities through information and prevention. How will we accomplish this? By working closely with over 20 community stakeholders to provide a variety of targeted services and resources. Among the many things we have planned for this year are community opioid summits and school presentations for parents and children, where addiction medicine specialists, recovering addicts, and parents who have experienced the tragedy of drug overdose in their family speak from the heart about the realities of illicit drugs and the harms they can cause. We will collaborate with our community stakeholders, including the LA Sparks women's basketball team, to create an after-school anti-drug mentoring program in 8 high schools around Los Angeles. We will provide training and resources to our partner prevention and treatment organizations, and we will undertake an aggressive social media campaign to raise awareness about the current illicit fentanyl threats in our community. For parents, I encourage you to conduct your own Operation Engage at home. Engage with your children and talk to them. Don't think these drugs are not available in your community or that your children are not aware or curious about them. Years ago, the opiate problem in this country was heroin. Heroin use, thankfully, had a stigma attached to it. It was a drug taken intravenously by sticking a needle in your arm, and heroin had to be purchased on a street corner, perhaps in a high-crime area. These factors kept many members of our community safe. It was enough to scare or discourage them from using the drug. Contrast that with today. We have fentanyl, a drug 50 times more powerful than heroin. It's disguised to look like an accepted prescription drug pill, down to the shape, size, color, and markings, and it's available in every bedroom in our city thanks to smartphones and online marketplaces. In closing, I would like to thank the very diverse group joined together here today for committing to share their stories, their expertise, and their resources with the people of Los Angeles. We are united, we are engaged, and we are committed to bringing all of our tools to bear on the current fentanyl overdose crisis gripping our community. Thank you. I would now like to introduce Chief Medical Examiner and Coroner, Dr. Jonathan Lucas of the County of Los Angeles.
Good morning. As was said, my name is John Lucas. I am the Chief Medical Examiner Coroner for the County of Los Angeles. And I'm pleased that the DEA has asked our office to be a part of this Operation Engage. I'll say, we at our office, we're no stranger to death as a result of drug use. As the COVID pandemic grew, surged again, and now may be waning, another problem which started before the pandemic has reached troubling proportions. In the past several years, we've seen fentanyl deaths slowly rise, but over the last couple of years, we watched as these deaths have increased at a rapid and dramatic rate, and it's now outpacing everything else. Fentanyl, as you probably know, has similar effects on the body like other opioids, like morphine, heroin, oxycodone, but many times stronger and can kill very rapidly. The amount of deaths that my office has seen has been increasing dramatically. In 2020, calendar year 2020, my department saw a 70% increase in fentanyl-related deaths over the prior year. And it's happening every single day. On average, last year, there were nearly 3 fentanyl-related deaths every single day in Los Angeles County. And as you just heard, fentanyl accounted for just almost half of all of our drug deaths in LA County last year. Counterfeit pharmaceutical pills, which frequently contain fentanyl, can greatly alter and take a person's life, no matter their background, their status, their culture. It's heartbreaking because every death is tragic. Families and loved ones are suddenly inserted to an experience they didn't anticipate, and they struggle to understand. How did a person die so quickly from a pill? Did they know what they were taking? These are difficult, painful conversations. Our department's committed to recognizing these deaths as we have and assisting our law enforcement partners and others in obtaining information that can help stop the distribution of drugs and prevent future deaths. Through this initiative, I hope to contribute to the education of the community about the dangers of these counterfeit pills and fentanyl, and reduce the amount of overdose in LA County, hopefully prevent the tragedy and sorrow that comes with a sudden and unexpected death. Thank you for your time. And now I will introduce State Senator Melissa Mendes.
Good morning, everyone. First, I would like to thank the DEA's LA Field Division for the invitation to be part of this event this morning. As a state senator representing most of Riverside County, I do look forward to partnering with the DEA on Operation Engage. The tremendous toll drug overdoses are having on our communities warrant this type of action today. Last year, my constituents Matt and Christine Capilouto reached out to me to discuss the death of their daughter, Alexandra, who in 2019 passed away after consuming 5 times the fatal amount of illicit fentanyl. It is fitting that we are here today on what would have been Alexandra's 22nd birthday. We have to join forces in finding a way to hold drug dealers accountable. Just 2 weeks ago, enough illicit fentanyl to kill 1 million people was seized in Riverside County. Fentanyl is a man-made drug in low-quality environments with absolutely no ability to have any type of quality control. No ability to control its potency. To make matters worse, it's then sold on the street with an appearance similar to prescription medications like Xanax or Percocet or oxycodone. These counterfeit pills are composed of insignificant filler and deadly chemicals like fentanyl. Alex Capilouto was poisoned in this manner when she purchased what she thought was oxycodone, but was instead given a lethal dose of fentanyl. And the suspected drug dealer is unlikely to face any consequences for her death. For the last 6 months, I've been working with her family and several other stakeholders to craft legislation seeking to prevent further tragedies like this one from happening in our communities. And I am proud to stand here today as the author of SB 350, which we have named Alexandra's Law, introduced earlier this month in the California State Senate. If this bill is passed, it would require an advisement to be read to an individual convicted of illicitly selling, transporting, or distributing controlled substances to help provide an understanding that their actions could result in the death of another human being and lead to a homicide charge. This advisement is similar to the one issued to a person convicted of a DUI. SB 350 will help provide the key element of implied malice for a prosecutor. If enacted, a repeat offender of future drug fatality can no longer be able to say they were not aware that this drug could kill someone. SB 350 will ultimately help prosecutors keep up with the increase and deadly drugs illicitly sold to consumers in the hopes of getting drug dealers off the streets. One pill can take a life. One pill. And sadly, Alexandra's family is not the only one to experience the loss of the child from fentanyl. In California, opioid deaths increased 27% from 2018 to 2019, and I will tell you I do not look forward to getting the statistics for 2020. These numbers, of course, have been exacerbated by the pandemic. In San Francisco, fatalities due to drug poisoning outpaced COVID-19 fatalities. When I began working on SB 350, 50% of all drug poisoning fatalities in Los Angeles County were attributed to fentanyl poisoning. So I am proud to partner with Operation Engage to make fentanyl less accessible to our kids. We'll continue to work hard to reverse this devastating trend. And while I have named SB 350 Alexandra's Law, you know, this bill is really in honor of every child that's been lost due to this deadly drug. Every parent here whose heart is suffering. Thank you. And who's up here?
We'll take questions now if there's questions.
Chief Bodner, good morning. Are you talking about then additional resources? How will this look? How will this operation actually physically look on the ground?
So we will have some additional funding to run this operation. Basically, it will just be a focused effort to address fentanyl at all levels of drug trafficking in the city.
To Madam Senator, if you could, I want to ask you about the legislation that you're introducing. Given the sort of the softer approach to crime in California, what are the odds that that bill's going to pass in any form?
Well, you know, the one thing I want to point out is we have taken a bit of a softer approach with this bill in that we are giving those who are dealing these drugs a warning. So instead of bringing the hammer down the first offense, they get the opportunity to be told in court, look, this is dangerous activity. If you do this again, you could face murder charges. So in my opinion, it is a softer approach. But to your point, it's not easy to get bills like this, you know, through the legislature in Sacramento. But we are reaching across the aisle and asking our partners to, because it's not a partisan issue. I mean, fentanyl doesn't care what political party you are. They don't care what your background is. And so this is a concern for everyone. Every single legislator in Sacramento has constituents who have a child or a family member who's died from this.
Are you getting support?
Well, we just introduced the bill a few days ago, so now we're going through the process, yeah.
Thank you. Agent? No one else is going to jump in. So the funding, this is a nationwide effort, correct?
Correct.
Okay, so can you give us an idea of what percentage of the workday of your agents here in LA will be dedicated to this?
Steve, the way it works is, so with fentanyl, the organizations that are bringing fentanyl into the United States and into the LA area, those are the same organizations that are bringing in methamphetamine, that are bringing in cocaine. Any case we do at the wholesale drug level will affect fentanyl coming into the country. Where our focus is going to be, and we right now have 2 dedicated teams working on overdose deaths, where we will be looking to charge people with a federal charge, drug distribution resulting in death. We have 2 full teams doing that 24/7. That's really where the crux of our focus will be, and also with social media. We have a cyber team that's working addressing online drug sales where the distribution of fentanyl has become very prevalent. What's happened over the past year with the drug business is the same thing that's happened in all of our businesses. That is, there's been a digitization. So a lot of the drug trade, not a lot of it, a portion of the drug trade has moved online, and has made these drugs more accessible to the young people in our communities, and that's one of the reasons why we're seeing increased overdose deaths.